The debate over tobacco control isn't just about saving lives. It's also about power, money, and who gets to define the science. I'm going to lay out what I've found, and you can decide what's hype and what's data. We all know the ugly math. Smoking kills about half of long-term users and harms almost everyone else exposed to it. Getting rid of combustible tobacco is a no-brainer. But here's the twist most people miss. The main killer is smoke, tar, and thousands of toxic combustion byproducts, not nicotine itself. Nicotine is the drug that hooks people, yes, and it isn't harmless, but the catastrophic health damage comes from burning tobacco and inhaling the smoke. That's why, for decades, the medical playbook has included nicotine replacement therapy, patches, gums, lozenges. Even the WHO and many health bodies say long-term use of these, for people who can't quit otherwise, can be acceptable because the risk is far lower than continuing to smoke. That's great for pharma companies that make them. But switch the delivery system from a patch to an e-cigarette heated tobacco device, nicotine pouch, and suddenly the politics go radioactive. Let's separate signal from noise. Multiple independent reviews suggest that, compared to smoking, vaping exposes users to far fewer and lower levels of the most harmful toxicants. That doesn't make vaping safe, and we still don't know the full long-term risk, but the direction of risk looks lower than smoke. Harm Reduction 101. Now the youth question. Teen vaping headlines are everywhere. US, UK, New Zealand. As youth vaping rose, youth cigarette smoking fell, often to record lows. Correlation isn't causation, and trends vary by place, but the gateway picture is more complicated than the slogans. Many teens who try vaping don't become habitual users, and the majority of regular youth vapers report a prior history with cigarettes. That matters for policy. So why do some global institutions treat all non-pharma nicotine as the enemy? Follow the funding and the forums. Bloomberg Philanthropies has poured hundreds of millions into global tobacco control, funding research advocacy groups, policy campaigns. The WHO's tobacco control treaty meetings are highly influential and, critics say, increasingly closed to dissenting harm reduction voices. In recent years, countries including Mexico, Malaysia, Bangladesh rolled out sweeping restrictions or outright bans on vaping and other alternatives. Sometimes shortly after international conferences where Bloomberg-funded advocates were prominent. Criminalizing safer alternatives designed to help people quit smoking is, frankly, mind-boggling. Yet that's exactly what's unfolding across the globe. So, is tobacco control really about health, or is it about power?